G'day, Stephen Playford is my name. I'm CEO of Australian Sheepskin Apparel located in Saskatoon, Saskatchewan, Canada. In this session we're going to be talking about shearing at the skin interface, which is a term used when a person's limbs repeatedly move over the bedding surface area, or when a person moves, rolls or turns and their skin tissue is susceptible to tearing or shearing at that interface, otherwise known sometimes as friction at the skin tissue surface as well. Well, what we're going to do in this session is identify the areas of concern where friction and shearing do become a problem and ways to overcome that. And also we're going to show you wounds that have been created by shearing and how Australian Medical Sheepskin was able to heal those wounds as well. In many circumstances, when we have elderly individuals, we have very thin skin tissue, and it is very susceptible when a person moves, rolls or turns in bed. They're very susceptible to tearing that skin tissue. And as you can see on this first the photo, we've got the wool fibre or the follicle of the Australian Medical Sheepskin. And the beauty of that fibre, not only as we've talked about in pressure reduction and we've talked about moisture reduction and being able to wick away the moisture content, is that every one of those follicles or fibres will actually move with the skin tissue when a person moves, rolls or turns in the bed itself, or on the lazy boy, the chair and such. And that enables the skin not to get caught so much and to be torn by the bedding surface that is creating friction or shearing at that skin interface. So you can see that the wool fibre or the follicles do move very effectively with the skin tissue itself. As we move on, you can see that this lady is laying on the Australian Medical Sheepskin in the hospital bedding surface. That is one of the best ways to prevent shearing-related wounds from a person moving, rolling or turning in the bed itself. And other areas though that we do have to deal with when people their feet are moving like this backwards and forwards in bed all the time, they have this shearing effect on the ankles and such, and a way to overcome that is by the use of the heel protector itself. Very effective device in stopping the breakdown on the ankle or the malleolus and such, and preventing that wound from even occurring before it becomes a problem. Also with the long boots that you can see there, this boot is designed to cover for shearing and so on up the sides of the calf and such, but at the same time in the next session we're going to be talking about maintenance of standard body temperature and limb temperature, and that is something that these long boots do very effectively as well. So we're able to prevent shearing related wounds by laying on the sheepskin, wearing it as footwear and such. But if we do happen to have a wound that has already occurred on an ankle bone or whatever the case may be, we are actually able to treat that wound with the use of the sheep's orb wound dressing as well. We're about to show you some photographs that are quite graphic in nature. They are a wound on the malleolus or the ankle, so viewer discretion is advised. The next slide that we're looking at here is the sheep's orb disposable wound dressing that is used directly on the open weeping wounds that we're about to now show you. That's the wool fibre side and the leather side of the product. And as you can see here, week one we have a wound on the anterior malleolus or the outside of the ankle, and this wound had been pre-existing for a period of around 9 months and was getting to well past the stage 3, almost getting on to a stage 4 because it was almost probable to the bone. The sheep's orb wound dressings were utilised, and the heel protectors were utilised to stop the shearing occurring any further. And as you can see from week 1, now we go to week 2 and we've got that sloughing around the outside edge of the wound. To week 3 we've got more necrotic tissue that is sloughing off. To week 4 you can see that we're down to a tiny little piece of necrotic tissue left on the ankle, and week 5 that wound has completely healed. There are many more examples that we have to show you for shearing related wounds. Any further information that you may require, you can go to our website at australianmedicalsheepskins.com. You can email us at australiansheepskinapparel@shawbiz.ca, and or you can ask any questions of the dealership that you may be looking for product at. And I hope you've gained a lot of information from this session, and you can look forward to more coming online. Thank you.